Yes, so the assessment centre, this has been set up for us to be able to see anybody with respiratory issues, that's breathing, cough, sore throat, that sort of thing, and to manage people with respiratory problems or with COVID-related issues. And the idea about that is that we're here to be able to take that workload off general practice and allow general practice to concentrate on other parts of their service that they need to deliver, but also to be able to minimise the risk of people with COVID going into GP surgeries or into the hospital. So we're here to develop an expertise and to be able to manage and assess patients. So anybody, if you have a respiratory problem or you have issues that you're feeling unwell with and you need some advice, obviously going online to NHS Inform, you'll be able to find lots of information there. But if you feel you need to speak to somebody, then what you should do is you should ring 111, that's NHS 24. You'll speak to a call handler there who will ask you some questions, and maybe they'll be able to answer all the questions you have. But if they feel that you need to have some further information and somebody a little bit more expert, they'll put you through to what's called the COVID Hub. Now, NHS Highland are running the COVID Hub for us and for the Western Isles and for Shetland and obviously for Highland. And they have got very experienced GPs working in there, and they will speak with you. And if they feel that you need to be seen and assessed, they'll pass them on to us. Now also, it may be me or maybe one of my GP colleagues working here in the assessment centre that might be speaking to you at the hub. So if you're then going to come through to us, what we would then do is we would want to talk to you and take from you the history, for you to tell us how you've been, how you're feeling, and to do all of that over the phone. We've also got this thing called NHS Near Me, which is a way in which we can do that by using video conference, and that's a fantastic thing. So if you have got access to the internet and you've got Chrome or Safari on there, then we can work through NHS Near Me, and you can see us and we can see you, and that helps us make an assessment. If we feel at the end of that that we need to see you and to be able to take some observations for that, we'd ask you to come along to the centre here. We'd ask you to drive here yourself if you're able, or to get somebody that's with you, in the house with you, to come and be with us. And if you can't get here yourself, then we've got a driver who can come and pick you up. We'd ask you to put a mask on so that limits the risk of you spreading infection to us. And when you arrive here, we will be wearing masks and gowns and gloves. But underneath all of that, we are just still these normal people, doctors and nurses, here to help you. So it will feel a little bit uncomfortable probably to begin with, but we hope you'll get used to that. And then when we see you, we'll try to minimise the amount of time that you're with us, just to reduce that risk of spreading infection. But what we'll do is we'll do things like take your blood pressure, take your oxygen saturation with a probe on your finger, and just talk to you a little bit more, make a plan together, and then decide how things will be taken on from there with you.
There's a national drive at the moment in order to swab our staff, and the reason for that is because we've got a considerable proportion of our staff off at the moment, either with symptoms or because someone in their household does have symptoms. If our swab service is able to establish that they're fit and healthy to come back to work, that will ease the pressure on our NHS services considerably. So essentially what that means is that we will have staff that are at home that may be well, but they have a family member who is unwell with symptoms consistent with COVID-19, such as a cough or a fever. And that staff member cannot leave their home for 14 days. If we're able to bring the symptomatic family member in for a swab, we're then able to test them and assess whether or not they are positive or negative for COVID-19. And if they're negative and the staff member is well, we're able to get that essential staff member back to work and help the fight against COVID-19. So yes, we have a drive-through service, and that still allows us and our staff to remain safe. It allows us to swab people as they drive up in their car, roll down their window. We do a swab of their throat, and nose, or if they're a child, just their throat, and then they drive off again. And that means that someone who may have COVID-19 is not coming into the building and not exposing